pregnant and no medical aid. What are your options in Cape Town? I am your Cape Tour and I give tips on pregnancy, birth, and postpartum. Follow me for more options and more advice. Okay, so what do you do if you find out that you are now pregnant, you got no medical aid, and no savings? Right? How do you navigate this whole thing? And what are your options? Firstly, you can give birth with state, and how that works is when you can't go directly to a third-tier hospital like Groote Schuur, Tygerberg. They will completely turn you away. Your first point of call would be to visit your local bank clinic. Bank stands for Baby and Antenatal Clinic, and that is where you would go and register your birth. And when I say register, is you'd go very early, take along your proof of ID, your proof of address, and you go there and they'll do a pregnancy test based on your urine with a urine sample. Once they've established that, you would go for monthly visits for checkups at the bank clinic, and once you reach about 32 weeks, they will transfer you to your closest MOU. MOU stands for midwifery obstetric unit, and that is where you will give birth if you're having a straightforward pregnancy with no complications. If they pick up complications in your pregnancy, you would be transferred to a second-tier hospital like Mowbray Maternity or one of the district hospitals, and that is where if you perhaps have high blood pressure, or you need to be induced, you're going overdue, or if you need to do a VBAC, a vaginal birth after a cesarean, or if you're having twins or triplets, multiples, they would refer you to a second-tier or third-tier hospital. If there are more severe complications, like you have had previous miscarriages, or you have heart problems, or you have physical problems for yourself, kidney problems, they would probably refer you to a third-tier hospital like Groote Schuur. Now, you can't nowadays you can't just go to Mowbray directly and say, I live in the area, and I'm going to attend here, and get someone's address like they do in the past. That is not possible anymore. All pregnancies will be all women will be referred to their local bank clinics. They are completely overworked, and they don't have enough resources to deal with pregnancies that are not complicated. For instance, straightforward pregnancies that can be managed at the local MOU or bank clinic. That is your first option if you're going by a state hospital, and everybody has access to these services. They are free of charge. If you're going to enter the hospital environment, there will be a cost based on your salary. They'll ask you for salary slips and things like that. If you're unemployed, it will be completely free. The second option would be to contact a private midwife, and you could go for your monthly checkups with your private midwife. And this is especially helpful if you are working and you can't go to the MOU for checkups, and you can't get off. You can go to private midwives for your monthly checkups, and at 32 weeks, the midwife would refer you to your closest MOU or district hospital to do the birth. Okay, that's the second option. The third option would be to have to birth at a private birthing center, and there are a few available in Cape Town. El Nisa in Rondebosch is one of them. There's also one in Durbanville. There's one in Parow. The Cayenne doula runs that one. Is called the Peacock Birthing Room, and there are a few around. You just need to ask on the birthing groups. Maybe you can. Whoever's watching this video can even comment some of the birthing rooms available. That is the private birthing units available, and the cost there could be anything from 15 to 20, even more, 1,000 rand. The medical aids do cover that, but if you don't have medical aid, you can perhaps save up for it or pay it off if you need to. And in these situations, if you birth at these centers and you need to be referred to a hospital due to a complication in the birth, they would get an ambulance and refer you to the closest state hospital. Then there's the option of a home birth, which is absolutely amazing. If you can afford a home birth, really consider this if you have the private space at home. And there are quite a few amazing, reputable home birth midwives in Cape Town that are very highly trained. They worked in state hospitals for most of their career, and then they went to do private midwifery. I've done a few home births and I've seen how they operate. They are very conservative in their approach. They bring along all the equipment they need to the birth that you'll find in an MOU. If you have a home birth, there's also a private ambulance on standby that can take you to the hospital immediately if there is a complication in the birth. And these midwives, they can anticipate such complications early on if it occurs. So the private midwives, they charge anything from maybe 15,000 up. Some of the midwives even less. I can't give exact amounts, but that's approximately what you're dealing with. They come to your home sometimes with an assistant, and or you can have your own doula present if that is required, if that is what you like. And once again, you can save up for it. If you just find out you're pregnant, you can save up for the home birth and pay her off. But if there's a complication and you need to be transferred to a state hospital, you will still be liable for charges, because obviously she is there for the birth and she's on standby. Each midwife works differently in terms of if you need to be referred early on in the birth. So that's available as well. Other than that, those are some of the options. I don't know if I've missed anything. If I have, please can you put it in the comments or just DM me and we can make a video about it. But if you don't have medical, it's not the end of the world. State hospitals are very capable of managing your pregnancy safely, and just go to your local bank clinic and get sorted.